Okay, so this is my assessment of the preschool age child. Because they're in the age range of 3 to 5, they'll most likely be with a caregiver. If they're nervous, they can sit on their lap and I can give them a toy to play with to distract themselves a little bit. So first I would come in, introduce myself to the parent and patient, get the child's name and birthday. While I'm talking to the mom and child, I would see how the child and mom are interacting. I want to see that the child is attentive, how well they can hear me, and how well they can speak depending on their age. I'll make sure that I don't notice any obvious deformities and that their skin color is consistent throughout. So next, I would just start with the vital signs. Okay. So first I would do the pulse. Okay, it's 102, which is normal for this age range, and it's regular. I would do respirations. Okay, it's 24 and regular, which is also normal for this child's age range. I would make sure that they're not putting in any extra effort. I don't see any retractions. Children breathe with their stomach, so that's what I would be seeing. Alright, and now we take the blood pressure. You want to make sure that you have the right sized cuff for the child. Okay, 94/60, also normal for the school age child, or the preschool age child. Right, so next that I know the vital signs are normal, I can start with the examination. So I would say to the mother and child, so I'm doing the examination to make sure that the child's developing properly, that they're in good health. So first, I would just start by looking at the head and make sure that their facial features are symmetric. I would palpate the scalp, see that their hair distribution's good, that their hair has a good texture, no bumps or anything like that. And then while I'm looking at the face, I would feel the ears to see if there's any pain there. Then I would go to the eyes. So first I would inspect the eyes, make sure that the eyelashes have good distribution, pull down the conjunctivae and see that it's pink and moist and that their sclera is clear. Then I could do perla, so I would just do this to establish that the child does have perla. Okay, and then can you just look at the pen light while you're looking straight ahead? Okay, you just want to establish that they are able to move their eyes smoothly in all 6 fields of gaze, which is good. Then I could use an otoscope if I had it, and I would just look inside both of the ears and look at the tympanic membrane and see that it's a pearly gray, which it should be. I could look up the nose. I would want to see that their septum's not deviated, that it's pink and moist on the inside. Next, I could do the mouth, so I would just have them open your mouth, say ah, have them stick out their tongue. When they say ah, I want to see that the uvula is midline and it goes up. While I'm looking inside their mouth, their hard palate should be intact. It should be pink and moist inside there. Their tongue should also be pink and moist. I will look at the teeth, make sure that their teeth are in good condition. Alright, and while I'm at the head, I can have them squeeze their eyes shut, puff out their cheeks, just to see how their face coordination is. Then I would have them do the muscle test, so just push it against my hand. And then I would do the same with their shoulders to see that they have good muscle strength. Okay, and next I would just move on to the arms. So first I would inspect them, Look for any lesions, rashes, anything like that. I would palpate, feel for any areas of swelling, edema, or red or heat. Good. I would do the fingers. I would test the capillary refill. It should be less than 2 seconds. Okay. And while I'm at the arms, I would just do their pulses. See that they are 2+ on both sides or bilaterally. Right, while I'm here, I can also do the lymph nodes. So I would just feel the cervical lymph nodes, axillary, the postauricular. Okay. And then also while I'm on their arms, I can test the muscle strength there, have them push and pull, and they can also pull my fingers. I just want to see that they have a good grip and can have good muscle strength against resistance. And also, while they're sitting down, I can have them do the finger to nose with their eyes shut to see that they have good coordination, and also do opposition to see that they have good coordination. Alright, so next I just want to listen to your lungs. So every time I put this down, just take a deep breath in and out. Okay, and I would just do that in the back as well to make sure that their lung sounds are clear on both sides. And then next I'll just listen to the heart. Okay, and I would just listen to see if I hear S1, S2, don't hear any extra sounds or any murmurs or anything. Alright, so next I'm just going to lay the child down so I can take a look at their stomach. So first, just look at the chest wall. I would see that there's no lesions or anything or any pulsations. When I palpate it, it should be stable. There should be like no deformities over their sternum or anything. Alright, so next I can just move on to the stomach. So first I would just inspect it, make sure there's no lesions, any pulsations, no distension noted. Alright, next I'll just auscultate. Okay, and they should have normal active bowel sounds in all the fields. Alright, good. So next I'll just do palpation. Since children are ticklish with their stomachs, I might first use their hand to guide it and then just use my hand. So I would do light palpation first. Feel for any masses, any areas of tenderness, and I will look for the same things as I do deep palpation. Alright, good. So let's just sit the child back up. Alright, next I'm just going to move on to your legs. So I would inspect them first, see that they're symmetrical, no obvious deformities that I note. See that the hair distribution's even, no rashes, lesions, anything like that. Then I would just palpate them. Feel for any heat or swelling or anything. Then I can move on to the toes. I would check their capillary refill down there. Alright, and while I'm on the legs, I could check their pulses down here. They should be 2+ bilaterally. Okay. And also with their legs, I could have them push their foot against my hand to see if they have good strength. Also, they can run their heel down their shin. I wanted them to do that on both sides so I could see that they have good coordination. Okay. And also for children, I would test their reflexes. So I would just get my reflex hammer, check the biceps, triceps, patellar, Achilles reflexes, and the brachioradialis one as well. Okay, and then I would want to stand the child up and then check their posture. Depending on their age, it depends like what type of walks I would do with them, but they all should be able to walk normally. I could do heel to toe, see how well they can like waddle walk, and make sure everything that's good. Yes, I think that's it.